these nutrients, it increases the function of the T suppressor cells. And the T suppressor cells are the cells that control the immune response. It shuts it off from overreacting to any stimuli. It's the defect in T suppressor cell function from poor nutrition, from low nutrient, high calorie intake, that is at the foundation of autoimmune disease. So this is really key. These nutrients control immune cell function. The T cells, the lymphocytes that are produced in the bone marrow, they're exquisitely sensitive to specific nutrients and specific foods. We get defects in T cell functions, specifically the T suppressor cells, that dampen down their activity. They almost become paralyzed, and they can't balance the immune functions. With checks and balances, we signal immune activity, and we have to shut it off. We signal it, we have to shut it off and control it. And the body signals it improperly and can't control it once it's signaled. It just gets uncontrollable and starts attacking the human body and not differentiating our external things that we're fighting from the external environment, like microbes or defects in our own cells that are abnormal, and it starts attacking normal cells. So these defects in decreased amount and function of T suppressor cells are reported in all types of autoimmune illnesses, and is foundational to repair this, is to fix the activity of those cells. And how do we fix the activity of those cells? We fix it by feeding them these green cruciferous vegetables. It's key. Because the cell function, the immune system function, is dependent on the isothiocyanates, the ITCs, from green vegetables. You need a plant-based diet. You need lots of vegetables. You need vitamin D adequacy. You need the beneficial fatty acids for a proper immune system function. That's especially EPA and DHA, to have them present in the diet. And a review of the literature on nutritional application for people with autoimmune disease shows that dietary manipulation provides a means by which patients can regain control over their disease. And that's published in a medical study, in a review study, in the medical literature, scientific studies. That was the conclusion of their study, that dietary manipulation does work. On the other hand, we know that drugs for autoimmune disease causes cancer. The drug of the autoimmune disease puts you at high risk of cancer to begin with, because it reflects the fact that there's some DNA damage that could lead to cancer. And then, the drugs make your risk of cancer ever so much worse. They tracked over 1,700 patients that were started on treatment by rheumatologists for 10 years, and they found a 400% increased rate of cancer in the treatment group in this 10-year period compared to the controls that weren't treated with these drugs. These chemotherapeutic agents that rheumatologists use are risky. So clearly, if there's a way you can get well without the drugs, wouldn't you think it would make sense to use dietary manipulation first? So let's review. If you have an autoimmune disease, like rheumatoid arthritis, like psoriasis, you want a high nutrient diet, rich in green vegetables, vegetable-based, using blended salads and smoothies to increase the consumption of these nutrient-rich foods. You may want to drink a glass of vegetable juice to bring your levels of these nutrients up, with beets and parsley and kale and carrots. High-dose EPA and DHA, because the high-dose omega-3 fatty acids have an immunomodulating effect to lower the overactive immune system. We want to give you beneficial bowel flora, the probiotics, because giving you probiotics can help prevent antigens, stimulants from food, from exciting your immune response. And it can help normalize the immune response, because very often the destructive of bacteria in the digestive tract could be a weakening factor in immune system abnormality. We want you to take vitamins and supplements with no folic acid or vitamin A. You want to make sure you have adequate vitamin D, of course. And the dietary avoidance of wheat, usually gluten can play a role, and salt and oils. You don't want to take in foods like oils that stimulate inflammation or that rapidly put fat on your body. You want to get the fat off your body. Now, the Lupus Foundation of America came out with a statement